Welcome. I'm Kay Hirschfeld, the Transitions of Care Coordinator in the Stroke Program. I hope this finds you all staying warm and well during these cold winter months. Speaking of being well, we have an exciting program to talk about on this month's educational webinar, a program that provides resources and support to stroke patients following discharge from the hospital. So before we get started, we have a few housekeeping items regarding your participation in this webinar. So this webinar is part of the MDH Stroke Monthly Educational Series. Stay tuned to any email or calendar invite for different educational opportunities each month, such as live recorded webinars. Because today's webinar is pre-recorded, we invite you to send your questions or comments to the Health Stroke email inbox or by contacting the presenter directly. You can also share your feedback in the corresponding evaluation of your contact hour. We'll begin the webinar by briefly going over the objectives for the presentation, and then we'll have Katrina Meyer from the Minnesota Brain Injury Alliance present on the Resource Facilitation Program, including information on the services the program provides and how to enroll patients in the program. So some of you may have already heard about the Resource Facilitation Program, and maybe you're already referring patients to it, so that's great. However, others, this may be new information for you. This is an important resource for hospitals, especially during the COVID-19 pandemic. Stroke data from the 2020 showed 20.2% decrease in ED visits and hospitalizations, and an increase in those patients that did present to the hospital having more severe strokes in discharges to short-term rehab and skilled nursing facilities versus home. While there could be many factors that come into play, one speculation is that patients may have delayed going to the doctor or ED with symptoms for fear of contracting COVID-19. We hope that learning about the services available through the Resource Facilitation Program will help improve this number, particularly for those patients who are at risk for a second stroke. So in terms of the objectives, we hope at the conclusion of this webinar that you'll be able to describe the patient and caregiver needs and experience during transitions of care into community and after stroke, discuss the free support available through the Resource Facilitation Program and how it can strengthen a facility's stroke program, and outline the process for referring stroke patients to the Resource Facilitation Program for further support after stroke. So now I'd like to introduce Katrina Meyer. Katrina has a Master's of Social Work degree, and she's the Public Relations Associate with the Minnesota Brain Injury Alliance. Some of you may have already met Katrina. She has met with hospitals throughout the state to talk about the Resource Facilitation Program, and she helps them set up referral systems to this program. Welcome, Katrina.
Thanks, Kay, for that introduction. So as Kay said, I'm Katrina. I work with the Minnesota Brain Injury Alliance and Minnesota Stroke Association. And today I'm here primarily representing the Minnesota Stroke Association, which is a sister organization to the Minnesota Brain Injury Alliance. And it's a statewide nonprofit that provides resources, support, and information to stroke survivors, their loved ones, and the professionals who support them. And then also, just as a note, we are human services providers and don't provide medical care. So today we're specifically looking at transitions of care for stroke. And we can go ahead to the next slide, please. Wonderful. So stroke patients and their loved ones will go through dozens of transitions as they venture through their recovery process. Some are very obvious physical transitions as they're moving from one care setting to another, and others are more ambiguous, such as ending home care, wrapping up patient therapies, and doing new social things like their first time gathering with friends again. All of these transitions can be a lot to juggle, and a little support can go a long way. So the goal of the Minnesota Stroke Association and Resource Facilitation Program is to be a bridge and support people as they are making transitions through their recovery. Next slide. So what is the Resource Facilitation Program? The Resource Facilitation Program was born out of a collaboration between the Minnesota Brain Injury Alliance, the Minnesota Department of Health Injury Prevention Unit, and a Mayo Clinic research project on establishing the TBI model systems of care. So this was all started over 20 years ago, and Resource Facilitation Program is now a fully funded program that is supported through state legislation. And then a little over 10 years ago, the Minnesota Stroke Association joined the Minnesota Brain Injury Alliance. And with that, the focus of the program broadened to support individuals of all types of brain injury with an additional specific focus on stroke. The Resource Facilitation Program is a statewide program for all Minnesotans, and as well as those who live maybe in some of those border communities and are looking for some support in Minnesota. We also will support those individuals. The program is confidential and voluntary. We don't receive any medical records of these patients, and they are able to choose when they want to start and end services with us. The program is built to be patient-directed with guidance from a knowledgeable healthcare or from a knowledgeable professional. And since we're not medical providers, we aren't going to be doing any prescribing or diagnosing or giving specific medical advice, but we are going to be providing lots of support on how they can make the most informed decision. And then every time a person calls in, it will be the same person that they are speaking to. Next slide. So this diagram shows you the basics of how the Resource Facilitation Program works. There are variations on this, but this is the basic format. After someone has had a stroke and is leaving a care setting, ideally they are connected with the Resource Facilitation Program through a referral. While they are home for the first few weeks getting settled in, we send them a packet of information to prepare them for their first call with a resource facilitator, which happens about 2 weeks later. The resource facilitator calls and does an intake with the individual, checks in on various aspects of life with the person, and out of that conversation, they are able to provide suggestions on supports and resources and information that might be helpful for that person. Then the resource facilitator helps that individual with accessing that information or resource that they suggest to the person. And we'll do often a follow-up call a week or so later to just make sure that everything went okay with the support that they provided. And then this cycle continues and restarts for another and goes on for 2 years. Next slide. So this is the basic timeline for the program, and this was established by the research that created the Resource Facilitation Program. We continue to use this timeline, but are also able to be very flexible with it. So traditionally, that information packet I mentioned is mailed out at the 4-week mark after either the individual has discharged from the hospital or from when we receive the referral form. And then the first call happens at the 6-week mark. The purpose of this is to allow the participant to settle into their new situation and figure out what their questions are. However, this format isn't a fit for every situation, and we know that, so we can adjust the timetable upon request with either a call from the individual that is participating, say, hey, I know this call is going to be coming, but we could really use some support sooner. Or just a note on the referral form that is connecting the individual with us. You as a professional can just write on there, please contact as soon as possible or within 1 week from discharge, whatever seems to be the most appropriate in that situation. Once someone is enrolled and receiving calls from us, we call them to do these proactive check-in calls every 3 to 6 months. For a 2-year time span. And again, this is a general framework. So some people need more frequent calls when they're dealing with a specific issue, or just some additional support calls in general. And participants are always able to request those additional calls, or our facilitators might suggest, let's do another call before the 6-month or the 3-month call, whatever it is that they're on. And so we're able to be flexible with that, but we just have this general framework to make sure that there is some specific time frame check-in points. And as I mentioned, it's a 2-year program, but this program can be shortened or extended depending on the needs of the individual. And people can always come back and utilize us, even if they've utilized us once before. We have had people come back multiple times. Maybe they're in a new life situation, and they just need some more support. So we're continually here to help people. And it is always free of charge, no matter what the situation is, how many times they use us, anything. It's always going to be free of charge. Next slide. So what does resource facilitation do? This list here is an example of some of the most common things that our resource facilitators help with. And as we're not medical professionals, we don't replace any medical follow-up that is already a part of your stroke program. But we often do help redirect patients back to their healthcare professionals and the support systems that they do have, reminding them that those resources are there. And we often operate as a safety net for those who are maybe experiencing a lot of transitions and who maybe don't qualify for some of the discharge follow-up supports. And as you look at this list, you'll notice that many of the supports listed are of the social emotional variety. And we've found that social emotional support provided by resource facilitation often ends up being a critical part of the support that individuals need for a successful recovery. Next slide. And so as we look at this, it kind of makes you think of those social determinants of health that can have such an impact on an individual's health outcomes. And some of the information that I have up here is some that was collected by the United Way by a study they did back in 2015, where they were looking at how some of these access to community resources and social situations that people live in impact health outcomes. And they had found that these social and environmental factors can account for up to 70% of an individual's health outcomes. So to kind of put that in another way, I have an example of the resource of food stamps. It's something that most people are aware that food stamps exist, but as it's a program that is there to support those who are food insecure, there's more people that are eligible than people that use it because there isn't an awareness around that. So about 51 million individuals are considered food insecure and eligible for food stamps, but there are about 8 million that are eligible and don't use this resource. And as a result, there is this ripple effect happening where they aren't having as good of health outcomes as they could had they had that food support. And some of those examples are if they aren't having the proper food support, they're 50% more likely to be diabetic and 60% more likely to experience heart failure. And there are a lot of reasons why someone doesn't use resources that are available to them, but a common one is that they don't know about the resource or think that they aren't eligible for the resource, even though they know about it. And people often don't know enough about the available resources to even know what questions to ask and what things to ask for help with. And this is an area where resource facilitation really shines. Next slide. So we'll start off with taking a look at a case example here of how resource facilitation can support an individual. So this is a true story about an individual who was in their 40s and came into the ER with stroke symptoms and was diagnosed with a stroke. They were treated in an acute ready stroke hospital and ended up staying there for their care. And after a few days were discharged directly to home. The individual was considered to have had very few health needs and a very good health outcome. Post-stroke, their primary ongoing symptom was that they had some mild aphasia. And so at discharge from the hospital, there was a RN care coordinator that referred this individual to the Resource Facilitation Program, as it is basically a pretty standard practice to do in their facility. So next slide. At the 6-week mark post-discharge, this individual received their first call from their resource facilitator, May. And during this call, when May was getting to know them, he noted that they were struggling with some elements around knowing how to approach their return to work, some socialization and mood changes. And many of these concerns from the individual, as they went on through conversation, she found were tied to things like a mental stigma that this individual is carrying with them, that others have had it worse, and so I shouldn't be struggling when it comes to their stroke. And the individual also, since they were a younger stroke individual in their 40s, they hadn't seen a lot of people go through these big health events and weren't sure what the norms and expectations were around returning to work. And then since the individual had very good health outcomes, which is wonderful, but still had some of those persistent aphasia symptoms, the individual presented with almost an invisible disability, and it was hard for that individual to encounter social situations as they were feeling very self-conscious about their speech. Next slide. So what did May do to support this individual? Well, the big thing that she did was she listened to the individual and validated their experience. That was a big part of just letting them know that it's okay to be struggling after their stroke, even though it was a mild stroke. It's a major health event, and it's okay to struggle afterwards, and that they're not alone in what they're experiencing. Then May also provided them with some articles and form letters and different types of resources to help them with that transition and looking at going back to work and what kind of things they can talk to people about as far as accommodations and what their rights are in going back to work after having a big health event like this. May also encourage the individual to utilize a support group. And this was an example where the individual knew about the support group. They were told about it by the social workers at the hospital, but this individual wasn't sure they were eligible to use this program. It's like, oh, I have a mild stroke. Isn't that just for those people who have the severe situation? And May was able to talk to them about how this was still an appropriate resource. And sometimes it is about just finding the right group to mesh with, but she provided some specific examples of some groups that would probably be the best fit for this individual based on their social situation and their level of stroke. And then lastly, May also provided some articles with information about aphasia and stroke in the context to try and help the individual be able to communicate about what they're experiencing with their loved ones and friends. Because sometimes it's just hard to know how to talk about some of these things, even if you personally understand what's happening to you. There can be some difficulty in knowing how to share that information with the people in your life. 5. So in addition to taking a look at this case example, I find it helpful to share what some other professionals have said about resource facilitation and why they choose to utilize it. So I have a few comments here from different professionals who utilize resource facilitation on a regular basis. First, we have here from Nellie, who is a social worker at an acute rehab. She says, I refer patients and families to the resource facilitation program because a person and or caregiver who has experienced a recent brain injury has had their lives turned upside down and need a place to turn to for help, guidance, and support. Despite every case being different, the resource facilitators understand what people are going through, what to consider for, and what options to explore. I trust them to get patients and families connected to the services that are available in their area. As a hospital social worker, it makes me relieved knowing that I can give patients and families the information for resource facilitation and that they have the resource and support to turn to when needed. Then we have another comment here from Kayla, who works at the Neuroscience Center, and she says, getting connected to the right kind of care can make a big difference, and resource facilitators understand that. My patients tell me that resource facilitation has helped them locate information during a time when that kind of task is too difficult or overwhelming. They tell me the resource facilitators are friendly and consistent in their follow-up with their questions. Next slide. Then I have 2 more comments here from some speech therapists. First from Valerie. She says, I highly recommend the resource facilitation program to many of my patients and members of the support groups that I facilitate. This program is valuable because it helps patients and their families in so many ways. For instance, they offer classes and resources and provide educational materials tailored to the person's specific needs. This connection is also very important to persons who have sustained a stroke and their family members, particularly after therapies have ended and the patients are not sure who to contact with their concerns and questions. And so this last quote from Hannah. She says, I have always found the resource facilitation program to be a valuable offering. And yet, especially now in these ever-changing times, I have relied more and more on the support of this organization to guide our patients to the resources they could most benefit from. And I am also so pleased they have Hmong and Spanish-speaking staff. Next slide. So that's how the program is helpful. So now let's take a look at how to get connected to the program, how to help patients get connected. So for me, a part of my job is trying to make this as simple as possible for professionals to help patients get connected, because it's really hard for the individuals to make that step to connect on their own, and they really benefit in their health outcomes to be connected to this program. So this first slide here it shows you our paper form that actually probably many of you might actually already have in your stroke binders, and have it attached to a flyer with some information about the resource facilitation program. And this form can be filled out and either faxed in, scanned, and emailed in, whatever works easiest. And I mentioned earlier that if it's helpful to add in some additional notes, such as please talk to the caregiver because they're the one needing the support, or the person has heavy aphasia, so communication on the phone is difficult, or maybe they're minimally conscious, or they need that support call sooner than that 6-week mark. Just anywhere on this form, in the margins, on the face sheet of the fax form, any of that, you can write those kinds of notes on. And then we do have like a little red box there around an area where you as a professional can put your information in. And that is primarily just for us to know how people are getting connected to us, to know maybe what support systems they have had in place. And then also if there is any issue with being able to read information on the form, to know who to go to get some confirmation on that. Because if we have an incomplete phone number, it's really difficult to complete a check-in call. And if you would like a copy of this form and don't already have a copy of it, please feel free to email me, contact me, call me, and I can send you a PDF of this form, and you can feel free to print and then make as many copies as you like. Next slide. And then this is another method that is available for making referrals. And this is an electronic portal that we have that is based on our Brain Injury Alliance website, but it's for everyone, including stroke. And this form can be filled out with verbal consent from the patient, and has all the same information on it as the paper form. It's just, you're able to type it in and hit send. So it's just a little quicker and easier for some folks. And to accommodate the need to like writing in the margins those extra notes, there is a comment section at the very end of the online portal form where you can put that additional information. Next slide. All right, so on this slide, I have an example of something that we created with actually Regents Hospital to kind of take a look at the flow of care that stroke and brain injury individuals often are going through their various areas of treatment. Because many people will go through different paths, whether they're going to inpatient rehab or straight home, whatever the context might be. So we made this flow chart to kind of look at where are some points that might be best to connect individuals with the resource facilitation program. And in the case of Regents Hospital, we identified multiple places in their system that we wanted to make sure that people were being offered resource facilitation, so that as few as possible people would fall through the cracks of not having the supports if they want it. And so one thing that was really helpful that Regents did is they incorporated this into their Epic system and put prompts in for social workers, nurses at different points where they're providing care, speech language pathologists, that was a big one. They put prompts in saying, letting them know to have these conversations about resource facilitation. And oftentimes for many hospitals, the go-to is the social workers at discharge being the ones to have these conversations. And that is an area where there's a lot of alignment of social workers, that being a big part of their role, connecting with people with resources, and is a great place to look to for getting people connected. But there's also a few other areas that I just want to provide some examples of how other areas can also be very helpful. I know there's multiple hospitals that will incorporate the conversation about resource facilitation in at the end of completing the modified Rankin assessment when they're doing maybe their 48-hour or 90-day call. Different people have chosen different points, but when they're doing those follow-up calls post-discharge, it's a great time to have that conversation, and then they can fill out that electronic referral form and get that sent in for the individual. Other examples, the speech-language pathologists at Health Partners have started incorporating the paper referral form as basically a worksheet that they utilize in completing an assessment that they need to do with the patient, with their brain injury and stroke patients anyway. And so they use the form for that worksheet, and then at the end of the session, have a conversation with the individual about, would you like to enroll in this program for support? And then they can just take that worksheet and send it in to us, and they're connected to a resource. Other places have found support from physicians like a recreation therapist, if that's part of the hospital's team, where they'll still have the social workers and everyone call in and make some of that support. But the recreation therapist can just have a little bit more flexibility to catch a few more people. And that can be another very successful situation. So those are just a few examples of some of the different ways where people have incorporated resource facilitation into their discharge planning, caring for folks as they're looking at a lot of transitions in their future. And I'm always happy to continue this conversation and talk more about what resource facilitation is, do some problem solving around what might be the best place and time to talk to folks about resource facilitation, helping train in staff on how to do some of those conversations. All of that I'm very happy to do, or whatever the need might be. I'm always open to feedback on what could be the most supportive for folks. And so we can go to the next slide. Here's all of my contact information. Please feel free to contact me in whatever way is most helpful. Email is usually, it's the quickest response, but also feel free to call me anytime. And with that, I would like to say thank you so much for taking some time to watch this WebEx, and I will turn it over to Kay.
Examples you gave and the provider perspective. We hope our hospital partners will consider referring stroke survivors to this wonderful program for additional resources and ongoing support. Katrina gave some great examples of, where this could fit into the workflow. So I hope you consider that and maybe reach out to some of those partners that are already doing the referring. The link to the evaluation is provided for you on this slide. Please complete the evaluation to receive your contact hour certificate. Please email the MDH stroke program with any questions that you have about this. As Katrina noted, please contact Katrina directly with any questions about the resource facilitation program. Feel free to reach out to me directly too with any questions you have related to transitions of care. So that concludes today's webinar. Thank you all for attending. Take care and enjoy the rest of the day.